To locate a trigger point in upper trapezius, drag palpation, where we look for increased hydrosis, increased sweat activity, is the quickest. I want you to tell me if this hurts when I compress it. Let me just get onto the point.
Yeah, that hurts.
Is it just a local pain, or does that spread at all?
It's spreading a bit to my neck and left face.
Okay. Now I'm stopping pressing for a moment. What I'm going to do is mark that point so we can... That'll help me maintain pressure on the right point. I'm going to press on that, and I want you to report back to me when the pain begins to change. I'm going to press for 4 or 5 seconds, like this.
Okay.
And then release, and then press again for 4 or 5 seconds. And I'll go on doing that until you give me some feedback that the pain is actually changing. Easing off and compressing again. Pain the same still?
No, it's changing a bit now.
Which way? What's happening to it?
It's getting less.
And is it less locally or less in the face, or all of it less?
Less, all of it's less.
Okay.
Yeah.
Okay. Now we're going to do something a little different again. I'm going to press it again, and whatever pain you now feel, I want you to grade that as a 10.
Okay.
You feel something?
Yes.
Okay. Still slightly in the face, is it?
Yeah.
Okay. Whatever you feel now is a 10. Give me that arm, and let me just try and crowd this a little bit. If I do that, the pain should drop. What score out of 10 would you give that?
Maybe 5.
Bring your right ear a little bit nearer to my hand, just sort of tilt it a little bit like that. And now what's the score?
Maybe 3.
Okay. Now, in that position, can you feel where my thumb is still?
Yeah.
I want to get that muscle to contract very strongly around my thumb. So I want you to bring your shoulder nearer to your ear and your ear nearer to your shoulder. Can you do that?
Yeah.
Keep going like that, keep going.
Okay.
So we've got a nice contraction there.
Yeah.
And release it now and relax it. Just put your arm down by your side like that. Okay, I'm going to try and stretch the local tissues here. Now I want you to ease your right ear towards your right shoulder. Just keep going until you feel a bit of a pull and stretch. You begin to feel it stretching?
Yeah.
Okay. Now your left, leave your head there. Now take your left hand down towards your left foot. Just stretch it, stretch it, stretch it, stretch it. Okay, and relax now. Now I'm going to hold that degree of stretch. Is that reasonably okay, not hurting you too much?
No, it's not too bad.
Okay. So we're stretching the tissues in which the trigger point was lying, and we're going to hold that for about half a minute. And just let the tissues lengthen and stretch. And they're teasing apart a little bit and stretching now. Okay. Now you're going to do that contraction again that you did when you brought your ear and shoulder together, but you're going to do it from this position. So I'm going to just stabilize those 2 points. I want you to bring your ear gently to your shoulder and your shoulder up to your ear. Can you just push those 2 points together? A bit more shoulder, that's lovely. And hold that. Now we're contracting the whole muscle. And release and relax. So you put your head over there a little bit like that. And again, slowly slide your hand towards your feet. Okay, and relax now. And we're just going to hold this whole muscle stretch. So what we've just done is a combination of compression, positional release, muscle energy to deactivate the trigger point. And that may be tender now for about a day or so, but the trigger point should reduce in its activity, and the pain you've been getting in the side of your face shouldn't come back, unless you do the things that stressed it in the first place.